Welcome to Focus on Seniors, a television show sponsored by Helping Seniors of Brevard County, Florida. The show is designed to make you aware of senior issues, needs, and resources available to help us age in place and with dignity. This show will help you as you develop your own aging and care plan.
I'm Joe Steckler. Welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County, a show designed to provide you with information on how to develop your own aging plan and care plan. Our topic today is dental implants, and with me in the studio is Dr. Lee Sheldon of Solid Bite Dental Implants. And welcome, Dr. Sheldon.
Good to be here, Joe.
I'm glad to have you. But this is going to be a little bit different type show because there's going to be so much demonstration that Dr. Sheldon is going to show you. And the beauty about this is when you see this show, you'll be able to go back to our website, Helping Seniors of Brevard, and be able to go to our demand channel and see this show once, twice, 3 times, how many times it takes you to understand what Dr. Sheldon is going to demonstrate. And I'm going to ask a few questions, but he is going to demonstrate why it's important for many people to have dental implants in order to protect your jaw, protect your health, and enjoy the food that you eat. So, Dr. Sheldon, what are dental implants?
Dental implants, Joe, are nothing more than metal roots that replaces the roots of the teeth that you had extracted. It's made out of titanium. Sometimes a dental implant is made out of a ceramic material called zirconia. And it's simply there to replace the missing tooth.
I've heard you talk about the dental implants with titanium and what's the other
Zirconia.
part? Zirconia.
Yeah.
Is that as strong as the titanium?
The zirconia is just coming on the market now. Actually, the first zirconia implants started about 8 years ago. And we're working with them now, particularly with people who have metal allergies and are concerned about metal allergies or are concerned that they don't want to have metal in the mouth. There is that ceramic alternative. It isn't nearly as versatile as the titanium implant, and this titanium implant is still the workhorse. And the titanium implant has been around now for close to 30 years. And
the reason I ask you that question, because as a submariner, having commanded a couple of submarines, I know the strength of our titanium hulls and our nuclear submarines and the new depths we were able to go to dive down to in order to withstand the pressures of the water.
Right.
So
yeah, and that's and the same way for us here. Dental implants, but titanium implants have been around for years and years and years, and they very, 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 very rarely break, and that's all those varies. And there's a lot of versatility, a lot of things that I can do with a metal implant, with a titanium implant, to make it fit nearly every jaw.
Hey, well, I'm not going to open my mouth and show, but I have one ear, folks. And let Dr. Sheldon, you take over, Dr. Sheldon, and you show people, because we've got so much to show.
We do. Well, so let's talk about the problem. And here's the problem. Here's a person with a full set of teeth. Now, I want you to picture this. About 70% or up to 70% of us clench our teeth. And that means we go like this. With these big muscles, go ahead, put your hand on the sides of your head and clench. And you'll feel these big muscles. Well, these big muscles are being absorbed, or the force is being absorbed by your teeth, right? Well, what happens when we're younger? What happens when we're younger? Well, first of all, let's take a look and let's apply that force. So I'll apply the force the same way like this. And this is a model of a full dentition. No wisdom teeth, but all the other teeth are there. So what happened when you were younger? When you were younger, there was a back tooth that had a cavity. And you decided, I'll extract this one. And another tooth had a cavity. I'll extract this one. And this tooth needed a root canal. Besides that, it was bothering me anyway. I'll extract this one. And we kept on extracting and extracting and extracting. And now what happens? We have the same muscles. Those are applying the exact same forces. Now look what it does to the teeth. And so we see that in essence, by not replacing the back teeth, where are the forces going to go? Only to the front teeth.
Right here.
That's right. And so either those teeth are going to come loose, or those teeth are going to start to wear away. Besides that, the back of the jaw doesn't have any support anymore. So then you start to get something called a TMJ problem. TMJ meaning temporomandibular joint is the joint, is the hinge where the lower jaw joins the skull. It's a problem. And when we try to replace those teeth, even with something that's removable, like a removable partial denture, that removable partial denture is still only supported by gum tissue. It's not supported the same way as your natural teeth did, because those natural teeth had big roots on them, and those roots were supported by the bone. So if we don't have that, what are the replacements that we have? And what's occurred over the past 30 years, and it's 1982. 1982 was the year of the dental implant. That's when dental implants were perfected, and it was determined that dental implants, in fact, could be as predictable or more predictable in tooth replacement than any other tooth replacement. So let's take a look at how a dental implant will work. And I'm going to just give you a model and show you a dental implant. So here's a model of two teeth that are missing. And I'm going to show you one way of replacing them, and then I'll show you another way. The first way is just grinding down the teeth. Okay? So we grind down the two teeth in order to be able to replace this missing tooth in the middle. And what's then made is something called a bridge. And this is called a fixed bridge. And the fixed bridge is then cemented in place over those two teeth. It's a good restoration. It's a good way of replacing teeth. But what do you have to do? You have to grind down the existing tooth structure in order to replace that one tooth.
Let me interrupt you one second.
Please.
I had this same thing done, folks, but they did this procedure to me because I already had caps on these teeth.
Right.
So what they just did was take the old caps off and make a new bridge, and did exactly what you said. But in my case, I didn't have to destroy a good tooth.
That's right.
I could already take something that had been ground down, and they modified that and put a bridge in place.
Exactly right.
So they did that on this side. And then what you're going to talk about is what they're going to do on this side for me. Okay, go ahead.
Let's talk about another way. So I'm going to take the two teeth again that were here. Okay? Let's assume that we don't want to grind down the teeth. Let's assume that we're not in Joe's condition where these teeth have already been ground down and had crowns on them. So instead, what we can do is place a dental implant. And now you can see where that dental implant is. It's a metal root support that goes into the jaw. Into that dental implant, we place a little insert. It's called an abutment. So here's the abutment. And then on top of that, we can place a replacement tooth. So now you have a replacement tooth, which is supported by its own bone structure, and you're leaving these two teeth alone. That's a simple way of replacing one single tooth. Now, some people ask about the cost. The cost of this is a little bit more, just a little bit more than it would be for the fixed bridge that I showed you before. But the benefits are tremendous. Not damaging these two teeth by putting a fixed bridge in means that these two teeth are not going to be subjected to some of the problems that could occur as a result of grinding down those teeth. So great advantage. And this is really the number one way now of replacing a single missing tooth, is not to involve the two other teeth, but to put in a dental implant.
And what's interestingly is that you did this and you put 3 of those implants in my jaw.
Yeah.
And after it was all done, I'm able to see those things down in my jaw. And then after waiting a certain period, I passed your test where this thing is, I guess, grown into my bone enough. Is that the right way to say it?
Yeah. There's a piece of testing equipment which was used in research for years before it was brought out into the dental community. It has a particular name. It's called an Ostel. And it works like a tuning fork. And one concern that we have is we want to make sure the dental implant itself, is ready to have a tooth on it. And so we can put a little post into your dental implant. And there's like a sonar wave that's coming from an instrument. And we'll determine whether that implant is vibrating a little bit, which is good, or whether it's vibrating a lot, which means it needs a little bit more time and a little bit more maturity for the bone to attach to the implant before it can be used. It's a beautiful instrument, and by having that instrument available to us, it gives us the opportunity of restoring the dental implant earlier than we used to. because now we can test it. Now we can see whether it's ready rather than wait an arbitrary 4 months or 6 months before the dental implant can be restored. So we can restore dental implants now. Well, in some cases, we can restore them immediately on the day that we put the implant in. But in most cases, wait 2 months, 3 months, 4 months before the dental implant is ready.
It depends on the person, too.
That's right.
And how fast you heal.
Yeah.
The beauties of what we've done, we can go back to your original model there.
Okay.
The first one over here. And open it up. And when you lose all these back teeth, there is nothing in your mouth that gives you the latitude or the capability to attach to that tooth to take the force back there. That's why having those implants in there takes the force from the jaws.
That's right. And so it's protecting you.
Yeah.
I mean, there's a side benefit here. You get to chew better. You don't have a big contraption in your mouth called the partial denture. But really, it does provide support. We all need support, no matter what part of the body we're talking about. And the mouth is such an intimate part of the body. You're thinking about your mouth 24/7. And if you have a big contraption in there, if you have a denture or a partial denture, believe me, if you've ever worn one of those, and I'm sure some of our viewers have, you know how much you're thinking about your teeth and how frustrated you are with your teeth and how you're thinking about what you can eat and what you can't eat and what you have to excuse yourself from the restaurant in order to be able to go to the bathroom and wash things out. And be careful, because if you laugh or you smile too much or you're talking too much, you have your hand over your mouth to make sure that denture doesn't come out. All of those things are common experiences that we see on our dental implant patients. And it is really a lifestyle change. One tooth is a tooth replacement.
Yeah.
Replacing all the teeth, big lifestyle change.
As a young officer in the Navy, I had a permanent bridge put in the lower part of my back part of my mouth by a couple of submarine officers that were dentists were on my submarine for a weekend. And they decided I needed this thing fixed. So what they did was they extracted 2 teeth and put a dental thing down or a metal thing down in my last tooth, and then they put a gold bridge on top of all that. Well, about a couple of years later, I'm on patrol. I'm in a submarine, and the after anchor post came loose. So I'm 2.5 months submerged on a submarine, and I could put my tongue underneath that thing, and it was flapping, but I couldn't get it out of my mouth. So this type of thing prevents that type of thing from happening. This is why when you watch these shows, there's so many practical applications of dentistry that we just don't think about.
Oh, there are. And until you need it, you don't know. The problem is that sometimes you don't know. You don't know what's available. And that's what we've experienced in our practice. People who have teeth that are floating in their mouths. People who have rotten teeth, and they say they didn't think there were any answers. And they come in after having years and years of failed dentistry. Really, some of them haven't been to a dentist in 10, 15 years simply because they thought there was no answer. When in fact there is an answer. Dental implants don't get tooth decay.
Okay. The topic, the name of our show is called Focus on Seniors.
Yeah.
How appropriate is this type of procedure for a senior citizen? Well, how old can you be and still get these things?
My oldest patient was 98 years old. And she had a denture that was coming loose all the time. She just wanted it to stay in her mouth. And so we put, in her case, we put in 2 dental implants just to hold her denture in place. But there's even another way where it can be even more secure with a different type of implant system. Let me show you that, okay?
Okay.
So here, let's just take this out. I'm just going to take this off this model for a second. So this is a lower denture. And a person can walk in with a lower denture, which, if you've worn a lower denture, you know how it fits. You know that it floats in the mouth. You know that when you move your lips, the denture moves. You know that if you move your tongue the wrong way, the denture moves. And you're literally playing a balancing act trying to keep that denture in place, right? So what can we do? And here's what can be done in the same day using the existing denture. You see down here, there are 4 little brass studs. Those are actually small dental implants. On the day of treatment, you make a small incision to the gum line if it's necessary. you drop these 4 implants in place. You take the existing denture, as long as the existing denture fits well and doesn't rock a lot. You take the denture and you can literally take out about 1 millimeter of the plastic material or the acrylic on the inside of the denture. And you can line that with a soft silicone material. We just mix up that silicone material chair side. We place it right in the denture. And then we seat it right back on or right into the mouth. The silicone material was set in about 5 minutes. And once it's set, you now have a denture which cannot come loose. Imagine the security that can provide immediately afterwards. So there's the way it would be, and you can see it snap in place. That's one of the simplest ways, and frankly one of the most cost-effective ways that somebody who has a lower denture can have security, and it can have that security right away.
You did an article on this for Florida Today.
Yes, I did.
But the thing that didn't come across in the article is the fact that that silicone product, when it's sealed, it forms like a place for it to anchor. You can still take that out at night and clean it, right?
Yes, you can. Same ways you did before.
See, a lot of people probably didn't understand that.
It's the magic of video. What a difference to be able to demonstrate that on camera.
See, I thought that it was like the implant and it was put in there permanently. I should have asked a question.
Sure. Here you are. So we can ask that question again, and I can show you how it can be done permanently. So let me show you some of the more effective ways. Not effective ways; they're all effective, but some of the beautiful ways in which teeth can be replaced. Do you see this? I'm going to turn it upside down because this is really upper teeth. I don't know if you can see this, Seth, but there's a little screw hole right there in order to be able to get that dental implant to seat in place. But so that people can see what they're getting, because otherwise this just looks like natural teeth. We'll put that back in place. This is a dental implant supported fixed prosthesis, fixed in place. That means usually 6 or 8 dental implants are placed. And our ceramist then creates a single piece of ceramic material with separate crowns, which are cemented in, not like this one, which came loose because I purposely had it that way. But here we have a beautiful set of teeth. I defy anyone to come up to you and to be able and tell you that you have dental implants with something that looks like this. This can all be done very, very easily and creates a smile that you can be proud of.
Are you talking about a whole set of teeth?
Whole set of teeth. This is a whole set of teeth right here. And notice, the palate is totally free. You know, one of the biggest complaints we have from our denture patients is that the palate is covered, the roof of the mouth is covered. And you can't taste your food very well when the palate is covered with a big piece of plastic.
Right. Yeah.
In this case, the dental implants are supporting this prosthesis. The roof of the mouth is totally uncovered, and this feels very close to what your natural teeth felt like.
Does this type of a denture, when it's put in permanently, how do you clean, or how does we prevent food from getting underneath there?
Right. First of all, there is going to be a slight space between this, the dental implant prosthesis, and the gum tissue underneath. And so yes, things can get down in there. And what we do is place little ports or little channels where you can put in floss or a water irrigation device, like a water pick, to be able to squirt out and clean out the material that will get underneath this. But because this is supported by dental implants, even if a little bit of food will get underneath that, when you bite down, you won't have that same feeling as you would with a denture, which is loose and a seed gets trapped. It's something that you'll clean out later on when you go to the bathroom later on at night.
Because when they put my permanent thing in here, I have a very thin, like a loop, that I have to put through the tooth, and it catches the dental floss on the other side, and I pull it through so I can clean.
That's right. And you'd use the same thing here. There are devices that are like that or similar to that to clean underneath this as well.
What I'm learning, though, Dr. Sheldon, and I think that viewers will get the same impression, is that the field of dentistry has certainly accepted technology, and we're doing so many more things. Have you got anything else here before we run out of time that you want to show?
No, yes, I do. I actually have some befores and afters, and I just want to show you what can be done.
Okay.
So let's take a look at the first one. This woman was just missing a single tooth, and this is a choice. It's a front tooth that's missing. And it was a choice for this patient to have the two teeth ground down on either side or to do this. And what you see is, with the dental implant, how beautifully that can restore that missing tooth. Now, what's important is to make sure that the gum tissue looks good before you put the crown in. Therefore, there is some periodontal plastic surgery that we also do in order to make sure that not only the tooth is in place, but the tooth is draped properly by the gum tissue. This is a patient who, through neglect and for other reasons, lost most of her teeth. And you can see that the teeth are rotted away. And she didn't feel that there was really any answer. Even the lower teeth that were present were not usable. They were decayed and they had periodontal disease. So literally, she had all of her teeth extracted. So now you see what it looked like. Now take a look at how the restoration is.
How many implants do you have to put in there?
We put, in her case, 5 implants on the lower arch and 6 implants on the upper arch. And these teeth were now totally fixed in place. I can tell you that she smiles more than she ever smiled before. I can tell you that some of the wrinkles that you see in her face, you even see those wrinkles now, have gone away in the several months since we placed those dental implants. This has been a total lifestyle change. Not being able to smile, not being able to talk, not being able to eat, and a total conversion into being able to chew everything comfortably as much as she wanted to.
Okay. I want to talk a little bit about insurance and the cost of these things, because people will think nothing about going out and buying an expensive car.
Yeah.
Or they'll think nothing about, or they think about it, but they still do it, buy a home they don't need.
Right.
But how many people will think about spending a little bit more to have their mouth correctly taken care of? And this type of work, when we're talking about surgery, time, technology, equipment that you have to buy in order to do this, because you do it in your office. You don't do this in a hospital or anything like that.
That's right.
But can you tell our viewers some of the cost of doing this? Because I think it's a fair thing, because people need to have an understanding that there are ways that they can pay for this stuff, can do it. This is not just getting a tooth filled.
No, it isn't just getting a tooth filled. This is a total difference. Don't forget, a lot of people had no cost for dental care because they gave up on dental care years and years ago. And rather than talk about the cost, because the costs are done on an individual basis. Some people have a lot of bone, it's a smaller cost. Some people have little bone and we have to bone graft, that's a larger cost. Some people want to go with one of the simpler techniques like relining the denture, that's a lower cost. Some people want to do the fixed in place, that's a higher cost. But what's important here is diagnosis, to make sure that we have all of the diagnostic entities available to us, CAT scan being number one, but also to do a mock-up of what the teeth are going to look like before we ever restore them. And so all of those things are important. It's inexpensive to get the examination done. And during the examination process, and everybody goes through the examination process in our office, spends a lot of time with our staff members in order to be able to determine which option they want, the lower cost option or the higher cost option. And what they do is just work through the process. The same way as you would work through a process if you were buying a car, buying a house, deciding how much you want to invest. What's interesting is the investment that people make is not just the single investment that's made in the dental implant supported prosthesis. That can be paid off just as a car payment would be paid off over a period of years. There are dental loan companies or particularly dental loan companies that provide loans for dental care. So that
that's
can be
the point.
done.
People don't understand this.
Yeah, you don't have to throw it out all at one time.
No.
But what's important is some of the success stories we have. Like, I got into a new relationship. Like, I can smile at work. Like, I got a promotion. Like, my sales, if you're a salesman, my sales have gone through the roof since I did this. There are intangible costs here by not replacing your teeth.
Yeah.
And by making the investment to get your mouth back to the way it was when you were a kid can make all the difference in the world.
Well, just speaking myself, with these 4 teeth out, I had a tooth that fractured on this side. And when they took that fractured tooth out, I had 1 tooth that met with my bottom. So I had a total crunching surface of 2 teeth.
Yes.
And, so I knew that I was being fixed over here. So I was happy I did it. And folks, this is the guy that you see him on television a lot, and he has the pink scrubs on. So, and we laugh about this a lot. Dr. Sheldon and I talk about it. We do our radio shows together. He's one of our columnists in a newspaper. But he also can explain this type of thing. Are there any age restrictions? And we may have talked about it a little bit. You told me you had, what, a 98-year-old person that you...
Oldest was 98. The youngest patient we've seen was, I believe, 18. 18. And so, it just depends upon what you want, what you need, and what you're missing out on in life. The fact is that people don't, particularly if they've been away from the dental scene, or if they've gone for dental care, but just haven't asked their dentist about what else is available, just kind of get in your routine of having the partial denture in, the teeth wearing away, that in fact there are other answers, just a matter of getting through the process of educating yourself.
If a person, as we grow older, we observed what we would call good dental procedures, good dental techniques. You get your teeth cleaned at least every 6 months, preferably 3 months, right?
If you have periodontal disease, every 3 months, correct.
Right.
Normal cleanings could be every 6 months. It depends upon what your need is.
How many people would you estimate don't get their teeth cleaned at all?
Well, we know that 50% of the people in the United States don't access dental care at all.
Oh, is that true?
That's right. And so those aren't the patients that I see. Or those are the patients who may have given up on dentistry. Or that's one side. And there's also a group, just to be fair, there's a group of people who don't need dental care, and so there's no reason for them to see somebody. They keep their teeth clean. They've never had a cavity, and they have no periodontal disease. Some may opt out of the market entirely. We'd like to see them to make sure that we diagnose disease early before it gets to the stage where you need all of this work.
But even if a person has perfect dental health, don't they still need to get their teeth cleaned?
I believe so, but there's some people who actually are resistant, totally resistant to disease. And I know they're out there. And I understand that. Am I going to say that they need to come in? I'd love to see them because things change as we get older, particularly if we go on medications, your mouth gets dry and they're more prone to tooth decay. So it would be a good idea to see your dentist for an examination just to make sure everything's okay.
Thank you, Dr. Sheldon. I've enjoyed having you as a guest.
Thanks.
And thank you for watching today's episode of Focus on Seniors. If you have questions or comments, please call radio station WMEL 631-1300. For more information on senior care and resources, visit our website, helpingseniorsofbrevard.com. Thank you for watching, and do take care of your teeth.